I am Gamal Surur, Professor of Obstetrics and Gynecology and Director of the International Islamic Center for Population Studies and Research at Al-Azhar University. I'm going to talk about reproductive health. Reproductive health, its definition, that is the enjoyment of the highest attainable standard of physical, mental, and social well-being of the reproductive system and all its processes, which means that women should have the right to have access to information and also all aspects of human reproduction, including the right to use contraceptive, to space their children, to decide the number of children they would like to have, and to decide when to start having babies and when to stop having babies. But also it includes the health of the young girls and how we can protect them from harmful practices like child marriage and protection from sexually transmitted diseases. And also the adolescents, they got to have the information about reproductive health. And when they get married, then they must receive the proper antenatal care so that pregnancy will end with a healthy child and a healthy mother. And then after delivery, the care of the baby and the care of the woman after delivery and provision of contraceptive methods so that she can space the children which she will have. But also it extends later on in life, that's when she advances in her age, we need to provide her with all methods for early detection of malignancy and also for the early detection of breast cancer and others, and the hormonal replacement therapy in order to overcome the menopausal symptoms which occurs. In other words, we can see that reproductive health is a life cycle. It starts since intrauterine life, childhood, adolescent, pregnancy and childbirth, postpartum period, and advanced age. So that is the definition of the reproductive health. Now, when we come to the position of Islam on this, we got to remember that human reproduction is two sides of one coin. One side of the coin is the inability to space children, to regulate pregnancy, but the other side of the coin is inability to conceive. That is inability to have children. And as much as we give care to women who would like to space their childbirth or who would like to postpone the childbirth, as much care as we give them, also we give to the infertile couple who are unable to have children. And when you look at the position of Islam and Islamic perspective on these issues, we find that Islam had encouraged family formation, childbirth, because in this there is a continuation of the human beings on earth, which is one of the 5 objectives of Islam. But also we find that safe motherhood also is again one of the objectives of Islam, which is preservation of self. So preservation of self and preservation of progeny, these are 2 important objectives of Islam. And therefore we find that Islam encourages childbirth, but at the same time it does encourage safe motherhood. And that's why Islam is very much supportive for child spacing, for prevention of childbirth in the early life, childhood pregnancy. It is also supportive of having a reasonable number of children, because when you look at this will reduce the maternal mortality, will reduce the maternal morbidity, and also will reduce the child mortality and the child morbidity. On the other side of the coin, that's the family who is unable to conceive, we have to provide her with every assistance in order to achieve pregnancy and childbirth, including the conventional lines of treatment of infertility, like surgery, reproductive surgery, endoscopy, but also advanced technique like assisted reproductive technology, the so-called test tube babies, by providing this high tech to the infertile couple, because Islam is supportive of progress of science, improvement of knowledge, and the use of technology for the benefit and for the happiness of the human being. So when we come to family planning, we find that family planning had been used actually at the time of the Prophet Muhammad, peace upon him. His companion informed the Prophet that they have been using coitus interruption for prevention of pregnancy, and he did not forbid them from using this. So coitus interruptus, that is ejaculation outside the vagina of the wife, is a temporary method of contraception. Now, by analogy, which is one of the sources of Islam, by analogy, temporary methods of contraception available today, like contraceptive pills, IUDs, intrauterine contraceptive device, implants, injectables, hormonal intrauterine devices, safe method, safe period, all these are temporary methods of contraception. And by analogy, they are very much similar to coitus interruptus, which was used at the time of the Prophet. So the fact that they exist today and we use them is because they were not available at the time of the Prophet Muhammad, but the development of science had shown that these are more effective methods of contraception, and that's why we use them. Furthermore, if you look at the Holy Quran, there is no nas, there's not a single nas in the Holy Quran which forbid child spacing or planning for pregnancy. So this is very clear position of Islam on the use of the contraception, temporary method of contraception for the health of the mother and for the health of the baby. And of course, there are other reasons like social condition, economic condition, and the other issues as well. Now, when we look to the treatment of infertility, yes, Islam is very much supportive of this because, as I mentioned earlier on, that having children, that's preservation of progeny, which is one of the objectives of Islam. And therefore, helping the infertile couple to have children is supportive by Islam. And therefore, one would ask, what about the advanced technology like test tube babies? That's where we take an egg from the wife, fertilize it with the sperm from the husband, and then implant the fertilized egg inside the uterus, the womb of the wife who is the owner of the egg. What's the position of Islam on this? Islam says this according to the fatwa from Al-Azhar on March 1980, that this method of treatment of infertility, the test tube baby or the in vitro fertilization, is encouraged for the infertile couple if it is necessary, with the condition that the egg is from the wife and the sperm is from the husband, and the fertilized egg is transferred inside the uterus of the owner of the egg during validity of the marriage contract. And all of us know that validity of the marriage contract would break by death of one of the partners or by divorce. So this method is allowed. And in fact, the introduction of this method in the Islamic world, since we started it in the year 1986 indeed caused a lot of happiness to many infertile couples whom in the past we thought that they will never ever be able to get pregnant. And now they have children, and of course this brought happiness to the infertile families. Then when you come to safe motherhood, yes, Islam has supported safe motherhood. If we look at the Holy Quran, where it was mentioned that we should care for the pregnant woman during her pregnancy, because pregnancy is a burden on the pregnant mother, and we should care for her during her period, the period of pregnancy. Furthermore, we should help her to breastfeed her child, and even if she is unable to breastfeed her child, then Islam encouraged us to hire someone to breastfeed the baby if that is possible, and it is an obligation of the husband to provide this assistance to his wife. And when Islam encouraged breastfeeding for 2 years, it is actually by itself, this is a method of contraception. Again, this is another evidence that Islam supports contraception, temporary contraception. And of course, the fact that Islam encouraged us to feed the baby, breastfeed the baby for 2 years is very important, because breastfeeding is very useful for the child and for the mother who delivered her child. Is useful for the baby because it provide him provide him or her, if it was a girl, with antibodies which would help to combat infection, and also with the proper constituent of nutrition which are necessary for the growth of the baby. And for the mother, because breastfeeding results in contraction of the womb, and that's the uterus, and the contraction of the womb after delivery, it prevents bleeding from the mother. So it has mutual benefit for both the baby and the mother, and the studies had shown that breastfeeding is the best method of providing nutrition for the newly born baby. And then we go to the late part of the reproductive life, that is the early detection of malignant diseases like screening for breast cancer or cancer of the cervix, or provision of treatment and assistance to women when they pass into the late stage of their life. And all of us know now that the life expectancy is getting longer and longer, and consequently a good part of the life of a woman is actually in the postmenopausal period. So she needs assistance for this. She needs detection of the malignant diseases, early detection of malignant diseases, so that they can attain the highest attainable standard of health. So if we go back again, the definition of reproductive health is the enjoyment of the highest possible standard of health of the reproductive system and its processes. It is exactly a part of the health as a whole, because the health is defined by WHO is the attainment of the highest possible standard of health, both physically, mentally, and socially, and does not mean just the absence of disease or infirmity. So to be healthy, it is not only just you are not having infirmity or disease, but you must be enjoying the highest attainable standard of physical, mental, and social well-being. Thank you.